I get asked all the time, are all chiropractors the same? Or do they do things differently? Because it seems like they do things differently. Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today we're going to talk chiropractic. And I love this because I am a chiropractor by training, but I actually work at the law firm too. So stay tuned. We're going to talk chiropractic technique next. There are so many ways to get good health care. And that includes all disciplines, but where I really see an incredible array of techniques is in the chiropractic profession. And I say that because I am a chiropractor by training, and so I've had the chance to, over the last 30 years, either be trained in, witness, or get adjusted by lots of different techniques. And so while the focus of this video is not to list out technique by technique, I will tell you that we'll talk about some of these in future episodes to kind of go into them a little bit deeper. But for now, here's what I want you to know. That what we typically see is that the main principle of chiropractic care is to get joints moving normally and muscles moving normally. So if we can get the body to move normally, that's a great sign that we're getting a message to the brain, that the brain says, oh, everything's okay down there. So now I don't have to send down pain signals. Now I don't have to send out distress signals, restriction signals, because I feel better. And thankfully, there's so many ways to do that. And it depends on the chiropractor's training. It depends on the type of problem and the type of patient. All those things go together to decide what chiropractic technique is best. Now, some chiropractors use only one technique and they use it on everybody. They apply it in the same way, but they just use different types of forces. So example, for a chiropractor that always does what we call manual manipulation or adjusting, where you hear the popping sound of the neck or the back or the elbow or whatever it might be, then they'll just use different levels of force on different parts of the spine and different angles, and it might be different positions, seated, standing, lying down. But then there are other chiropractors who are trained to, in some cases, based on the condition, based on the patient, based on the timing, that they might use an instrument. And on some cases, they're going to use hand adjusting. On some cases, they're going to focus on muscle. And some cases, they're going to use more mobility training or mobility tools. So the point of the video is that chiropractic techniques vary incredibly between each other, but they all have the same thing in mind, and that is to restore function to the joints and to the muscles and make the nervous system work at its highest potential level so that the brain tells the body, you need to work better. And when the brain tells the body that, not only is there less pain, there's more motion, and there's just an overall sense of well-being. So regardless of the kind of technique that the chiropractor uses, make sure that it's right for you. You can ask the chiropractor what this technique does, how it works, do they have any other techniques? All of these things are important questions to ask, because what you'll find is a lot of times a patient prefers a certain style on their body, a certain set of techniques, and then they will oftentimes gravitate towards providers that do that same thing. So it's all about relationship when you're talking about chiropractic. It's the doctor-patient relationship, and it's the relationship of a technique with a condition at a given time. So I hope that helps you understand that there's lots of great ways in chiropractic care to help people. If you have any questions about chiropractic care, please feel free to email me, jim@ramoslaw.com. And if you found this video helpful, would you do me a favor and share it with someone? It would mean the world to me. Thanks so much, and remember, your health matters.